Oh.
Hi, I'm Catherine, and today I'll be discussing how foam roll and static stretch felt after doing those body weight overhead squat. So I initially did those 10 reps of body weight overhead squat without foam roll and stretching. So it did feel a little bit hard to do. I had a lot of hip stiffness while going down and a lot of burning going down the quad and the shoulders. I did feel my form was not as good as it should be. I wasn't able to go as down and do as much of a hip hinge as I should be doing. Once I started my foam rolling session, I had a lot of discomfort in some muscles, not all of them, but a few. So the main ones were the gastroc, but only in the lateral aspect of it. So I had a few trigger points going down here. If I had a few pain at the TFL and the piriformis. I don't know if it was because of the muscle tightness or because I was closer to that bone. So it was like, that's why it was painful. If not, for the IT band and the quad, there was more tightness and discomfort at the mid region and proximal region. The muscle that surprised me that was most painful was actually the adductor. So I don't know for what reason, but this one was the most painful of all the lower body muscles. As for the upper body, I did feel a little bit of trigger points going through the lats, and that was a little bit of discomfort. If not, for the pec, there was no trigger point felt, but it was a little bit more painful when I was closer to the insertion. So when I did the body weight overhead squat after the foam roll session, it did seem easier to do. I was able to go lower into my stance, no more squirting session in either the shoulders or the quad. And yeah, so I was able to load more, go lower, and have a proper form for it. When I started to do the static stretching afterwards on just that one side for the foam roll complex and static stretching, and then just the static stretch on one side, the same muscle area of discomfort were similar. The main ones were the calf complex when I did the stretching, but that one I felt it more at the Achilles region than the upper belly of the gastroc. If not, I did feel it more at the adductors as usual, and I did feel it more at the hip flexor when I did the half kneeling one. As for the upper body, the only one that had more discomfort was the lats. Other than that, the other muscles were pretty comfortable for me. I do believe for the reason why I had those discomfort for those muscles, either for the foam roll or the stretching, was because of my job. I do have to stand up almost all day. I'm an athletic therapist. I work 7 days a week, sorry. And yeah, so around 9 hours a day, sometimes 12 hours, depending on what kind of day we have. I think in one day, I sometimes sit maybe just an hour a day, and that's just for charting what I do with my athletes. So day to day, I'm just always standing, walking, running around. I have to treat, rehab the athletes, jog, walk around practice to give water, set up the field, so I have to push all the trunk, the cart, the water, in the slant, and on the turf, so there's a lot of more sledding, pushing kind of motion going on in my legs. And as for treating, rehabbing those guys, I do have to lift a lot of those legs for mobility and stretching, and then also moving the arms around. So there's a lot of loading in my legs to kind of like hold the body, but also a lot of upper body muscle going on to move the body parts around. And also for muscle releasing, I try to use the whole body for it and not just the arms. So I think that's the reason why there's a lot of tension going down the legs, just because of like all the walking and standing around. When I performed the body squat after the stretch, I did not feel that much of a difference between the foam roll and stretch and just the stretch on both legs. The only difference I felt was that the one with the combination, I was able to go a little bit lower and maybe load a little bit more on that leg than the other one. But if not, there was not much of a difference in the feeling of the muscle. Same thing for the overhead. I felt I was able to push more maybe on that side, but other than that, not much of a big difference. So I do believe if we do a warm-up before exercising or performing, maybe foam rolling will be a better idea than just static stretching. But if there is time, combining both could be good. But if you have to choose, I would choose foam rolling. Thank you.